Juliette O'Brien is a data journalist and Professor Mary-Louise McLaws is an epidemiologist at the University of New South Wales and an advisor to the World Health Organization. Mary-Louise McLaws, what's the difference between lockdowns? We're hearing a lot of different requirements in different states.
Well, in New South Wales, the lockdowns could have been described as happening late on day 9 and did not have very, very specific requirements. So a lot of things were left up to interpretation. So no one knew exactly what an essential service was or what essential movement was, because many of the retail shops were open, which gave people a mixed message, and many people could meet in various size groups as they were walking and chatting to people. They often didn't wear a mask in public versus lockdowns, for example, in Victoria that happened on day 3 and were very clear about what you were allowed to do and what you weren't allowed to do.
Well, Juliette O'Brien, what's the data showing us about the impact of lockdowns in New South Wales and Victoria?
Well, Laura, the data is essentially showing a plateauing. As we all know by now, the data shows a lag. So it shows us what happened at least a week ago. And evidently there was a fair amount of catch up to happen in households in the southwest. So we've had a few days of big numbers in cases, and the last couple of days, those high-level numbers have come down. So we do seem to have stability in case numbers. However, that is stability at a high number. We're talking high 70s, 80s, and it was over 100 for a couple of days. And for that to be plateaued after almost 4 weeks in some kind of lockdown is a little bit concerning.
Well, Juliette, what's the difference that we can see, if any, from the data about the impact of the Delta variant and how effective lockdowns are in the circumstances of that variant?
For the last really 17 months, we've seen New South Wales Health essentially use this approach of graduating up restrictions based on data points and triggers and the scenario at any one point in time. So they introduce restrictions, see how it goes, and then they might introduce more restrictions. This is exactly what they did with this time around, and also what they did with Crossroads. With Crossroads, we never entered a lockdown. We never got that far. This time they've graduated upwards, the same approach, very different outcome. And it really seems as though, we talk a lot about being in a race with the virus in terms of these outbreaks. And it seems like we're in a race and the opponent has taken some sort of performance-enhancing drug. It's just a bit faster than us in this race meet.
So Mary-Louise McLaws, we've just heard that Orange and the surrounding area look like they're about to go into lockdown too. This must be a pretty disturbing sign about the spread of the variant once more.
It is very disturbing because it says it's actually got this regional creep, and that's what you worry about. But it's very good news that they're going into lockdown, because just like South Australia has gone into a rapid lockdown, because that's exactly what you need to do with Delta, because the rules have changed. The 1.5 metres rule doesn't hold anymore. The 15-minute doesn't hold anymore, and being outside as if it's highly protective may not work anymore. So the fact that they've done this lockdown, because everybody's highly interconnected in these regional areas, is an excellent strategy, but it is very concerning, and it's exactly why you need to lock down as soon as you've got one escape variant of concern. You can't wait for 9 days.
Juliette O'Brien and Mary-Louise McLaws, thanks so much for your time tonight.
Thank you, Laura.
Thank you, Laura. Stay safe.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.